I'm James Sutton. This is Road to Recovery. Today, my special guest is a good friend of mine. He's been a friend of mine for like 21 years, matter of fact. Uh, it's my friend Parrish Carter, who lives in Baltimore. And our subject today is recovery and HIV. So welcome, Parrish. How you doing, man?
You doing, Jay? Thanks for having me.
Yeah, good. Thanks for coming. So I had thought about doing this show today because last Tuesday, December 1st, was World AIDS Day. And here in Montgomery County, we had an event, Department of Health and Human Services, the Public Health Services, they were rolling out an initiative about ending HIV epidemic. The federal government has a plan to end HIV at least by 90% by 2030. So that's a very ambitious initiative. So it really sparked my interest to talk to some people who were on the ground and had information about HIV and how it's been working in terms of services and uh, in terms of social acceptance and stigma, because this program is about reducing stigma for people in recovery from substance use disorder and people coming home from incarcerations. There's a lot of stigma for, people coming home from being incarcerated, returning citizens. So I remember there was a lot of stigma when I got clean in 2099, I mean, in 1099, 1999. And there was a lot of stigma about HIV. And I wanted to talk to you, somebody with lived experiences. And it takes a lot of courage to share about, issues like being incarcerated or being in recovery from drugs and alcohol or alcoholism or HIV. So I applaud you for coming on the show. And I'm sure a lot of people are going to be helped by what you shared today. So can you start off by telling us a little bit about how you got into recovery and uh, start off that conversation?
Yes. Again, thank you for having me, Jay. I got into recovery by way of I was homeless for 2 days because of my drug use, and I it was cold during that time, that period of time, so I had to get off of the streets and to get some warmth and some food. And I went to a friend's house, and next thing I knew, in the next couple of days, I made up in my mind that I needed to get off of the street and get off of drugs and alcohol. And I went into treatment, and the rest is history.
Great. So how long? So you've been clean for how long?
Since 1993.
Since 1993, day and night,
Yes, day and
weekends
night.
included.
Yes, day and night. No interruptions.
Okay, so that in itself is a victory because it's very difficult to get clean in the first place. Most people don't even make it to treatment. But those that do make it to treatment, a lot don't stay. And you've stayed for that long. So you're really like a power of example for those that are struggling today. So I'm so glad that you're able to share that. And what about your HIV status? Can you share a little bit about living with HIV?
I became positive in 1989 through my drug use. And I thought it was the end of the world. Excuse me. I thought it was the end of the world when I went and got myself checked out at the clinic. And I said those famous words, forget about it, my life is ruined. And I'm going to keep on using drugs and alcohol. And I did that all the way up until 1993. I found out that this HIV and AIDS is not a death sentence.
Right.
You know, I'm prime example. It is not a death sentence. I've been positive since '89, and I'm still here.
Right.
I don't think I would be here if I kept on using drugs and alcohol. But I'm glad that I'm clean, serene, and free from drugs and alcohol. The HIV, it still gets me sometimes today, but I try not to dwell on it or stay in it too long, because I'm clean and serene today, and life goes on. I'm working and all. A lot of my friends and people that I know and family supports me 110%. And it's to anybody out there, it's not a death sentence. I used to think it was, but no, it's not a death sentence. The medication that I take is way better than it was back then. The ADT and stuff like that. It's I'm living good, and I would not trade this in for nothing else. Maybe for $1 million, but I don't think I would trade it in for $1 million, because I would be dead in a day if I
Right.
traded it in for anything, but no, I wouldn't trade this life in for nothing.
Right. Great testimonial. Now, you know, when you first came into a recovery and you were HIV positive, there wasn't a lot of information, and so there was a lot of stigma. Uh, then, so can you share? Has it gotten better for people with HIV that are positive? Is the stigma? Were you accepted in your recovery community, or in your family, or in your faith community? Employment. How did people treat you? Uh, or did they didn't even know that you were HIV positive? How'd that work?
Well, I didn't walk around with a sign on my back, "Hey, my name is Parrish, and I'm HIV positive." No.
Right.
Um, I used to hear the little snickles about HIV, people with HIV, people and their relatives with HIV, and how they didn't want them around, and you know, um, the stigma it's a lot better than it was back then.
Okay. Okay.
Back then, it's more acceptable right now, even though people still behind closed doors don't talk about it because of a family member or someone has been affected by it, you know. And it's like a hush hush thing, still some of it today,
Okay.
but it's out there, and just like the COVID, it's out there. But no, it's somewhat a hush hush thing. I see,
Okay.
you
Okay.
know.
What about services? Have services improved in the community for people to get tested and to get treatment?
Yes, it has. That's up to the person.
Okay.
If they want to get tested, if they want to get off the drugs and get tested, you know, society is a lot acceptable to it, and it's, to me, like I said a couple of seconds ago, it's still a hush hush thing
Oh, okay.
that people, I don't want to get tested because I don't want my partner to leave me, or I don't want to get tested because of this or because of that. But it's a lot better than what it was. The community, um, the community is somewhat open to it, but it's up to the individual. It's a lot of clinics open now than what it was years ago. A lot of testing and all that is happening right now.
Good. Good. Now, what about organizations? Do they still have the organization called Hero and different groups that will advocate for people with HIV and AIDS to reduce stigma and get, because I remember that, I think there was one called Hero that would help you get housing and different things. Are there any services that are really supportive?
Yeah, it's Hero went out of business because of some stuff that was going on there a long time ago.
Oh, okay.
And there's a lot of community organizations
Oh,
that can
good.
help an individual get housing and stuff like that. And like I said, that's only if the person wants to get help. You
Right.
know, a lot of people, from what I've seen over a period of time, are still on drugs and alcohol. You know, and that affects their decision making and their thinking to get help. You
Right.
know, and like I said, I'll say it 1,000 times before I'm done with this interview. If they want to get help, and it's a lot of organizations out there. Yes,
Oh, good. Good.
yes,
That's good. So there are services and organizations that will help you get treatment, get housing, get other supportive services. That's great. I'm glad to hear that we're doing better in that area. Because as long as it's like a stigma and nobody wants to, you know, come up front and say that they have tested positive or even get tested, then it's, you know, it's just going to get worse and worse.
right,
So
right,
you have to at least admit that you have a problem. Kind of like with recovery, you got to admit that you have a problem before you even start working on recovery.
right, exactly.
So uh, we're getting ready to take a break in a couple of minutes. But when I come back, I was going to ask you about peer support. Is there peer support for people with HIV? Do they have like uh, people that have lived experiences with the disease go and help other people go out and do outreach and stuff like that?
Yes, it is.
Any particular organizations that
Um,
you want to give a shout out?
John Hopkins, University of Maryland, has a lot of peer support going on with people coming into their hospitals and seeking help.
Okay.
And next thing I know a couple of people that works for Hopkins and University of Maryland that started off with checking themselves out to see if they have HIV and AIDS. And next thing they knew that they were working for them
Oh,
as
good.
peer support projects and stuff like that. Yeah,
Good, good. Because that's what we want. We want people who have lived the experiences to be valued, you know, and not looked upon as, you know, a stigma because, you know, you used to use drugs or alcohol, or you are HIV positive. That's a valuable experience that can be used to help another person get out of that dilemma. So
yes.
we're gonna take a pause for the cause, and then we'll be right back with my good friend Parrish talking about HIV and recovery.
Hello, I'm Pastor Anthony Witherspoon, and I'm a member of the City of St. Louis Department of Health Clergy Advisory Board. As World AIDS Day approaches, we're reminded that in the United States, approximately 1.2 million people live with HIV, and the U.S. Centers for Disease Control and Prevention estimates that nearly 1 in 8 people who are infected don't know it. We're all called to open our hearts with compassion and unite in the fight against HIV, to show support for the people living with HIV, and to commemorate those who have died from an AIDS-related illness.
Hi, I'm James Sutton. My guest today is my good friend Parrish. Our subject today is recovery and HIV. And before I get right back to Parrish, I just wanted to give a little data about Montgomery County. The data I got last week, it says there are estimated 4,111 people living in Montgomery County with HIV. 3,544 of those have received a diagnosis. So that means that there's 747 people in Montgomery County that haven't even got a diagnosis, which means they could be continuing to give other people the disease because they haven't even been diagnosed yet. So HIV is a real issue here in Montgomery County. It's not like not in our backyard. It's actually here, and it's an issue that we need to face and provide some initiatives to help decrease the amount of people living with HIV untreated. So I just wanted to give that data before I get back to Paris. And I'll give you the contact information as to where you can get services in Montgomery County at the close of the program today. So Paris, we were just talking about peer support. You were saying Hopkins provides some peer support. People that are living with HIV are providing services and connecting with people that are in active addiction and people that may not have been tested yet.
Yes. I get my services at John Hopkins.
Okay.
And they have a peer support system at John Hopkins. I never joined. I didn't at the time didn't want to join because I was working. But yeah, there's a lot of peer support in the community. Not like it was back then, but it's there.
Okay.
It's there for the taking if anybody would want to check it out.
Okay. And let me ask you this, because you've been HIV positive for how long?
Since 1989.
And how long have you been in recovery?
Since 1993.
So how were you accepted in recovery? How did you approach your recovery? How was it back then, and how is it today? Have people got more accepting, or how is it in the rooms?
Back then, I didn't raise my hand right away to say, "Hey, Parrish, my name is Parrish. I'm HIV positive."
Right.
You know, I was afraid to say it. And after I hear a lot of stories in the meetings and people was sharing their experience being HIV positive and using drugs at the same time, I loosened up a little bit, and I finally opened up about it. And I didn't have no problem with people. The only problem I had was me.
Okay.
I didn't blame anybody else. They didn't hush me away or anything. They applauded me and accepted me, and a lot of people would come to me and say, "Hey, I'm glad you shared about your HIV because it helped me a lot, to go on with my life each day, a day at a time." And like I said, the rest is history.
Right. And that's why I asked you to do this show, because being on this show, you'll be able to reach a lot more people who probably haven't been able to reveal their HIV status or may even go get tested. So
Sure.
by your being here on this show, you're probably going to help a lot of people by you having the courage to come out and do this show with us today. So thank you again.
You're welcome, man. I'm glad to be here, and I hope I'll be welcome back.
Oh, you will. And what about your family and your church, your faith community? How has your journey been with them and your recovery and your HIV status?
My family just wanted me to get off of drugs.
Yeah. Okay.
And then came the HIV, and they accepted me 110%.
Oh, that's great.
They just wanted me to get off of drugs.
Right.
I mean, I was terrible.
Okay.
But they just wanted me to get off of drugs, and to this day, they're glad that I'm off of drugs a day at a time and staying off of drugs.
Right.
My friends they're the same. They just wanted me to get off of drugs.
Okay. And what about employment? Have you found it difficult to find employment?
No, employment. I used to volunteer at a food pantry, and to this day, I'm still there. They offered me a job there.
Oh,
As
okay.
a food coordinator to help out with delivery of food. We get a lot of our food from Whole Foods, And
Oh, that's
we
good.
distribute it. We have volunteers to come in to distribute the food to people that needs it.
Oh, that's
And
great.
it's been wonderful for the last 3 years that I'm going on 4 years. You know, I work there and only like 3 days a week, and I have my little lawn care business during the summer, and it's been great. It's
That's
been
great.
great, and no complaints at all. Uh, my church going thing, I haven't found a church home, no, but I still believe that there's something out there other than me that helping me stay clean a
Right.
day at a time. You know, it's not
Right.
all me.
Right.
It's
Yeah.
not all me, man.
I feel you.
Yeah.
And yeah, in choosing employment, I did the same thing when I got clean. I looked for work that was like less stressful, work where I could help others. Uh, and it sounds like you did the same thing. Uh, you're working in an area where you help others and get paid at the same time. And I did the same thing. That's why I went into becoming an addiction counselor, because I wanted to not only get paid and be able to make a living, a viable living, but I also wanted to help others in the process. And it sounds like you're doing that and doing it well. So that we're like both along that same mindset to
I
work
got I
and
gotta
help
keep
others.
busy.
You gotta keep
Gotta
busy.
Yeah, I
Okay.
gotta keep busy. I don't like sitting around. You know, the only time I sit around is when I'm watching ESPN or something, some sports or something, and then I'm off today or whatever. But other than that, I don't like sitting around.
Right. Yeah, me either. I'm always busy too, man, trying to
Right.
either help somebody or do something that, help my family. Because, I got a family, I think I got like 4 kids and a wife in the house. So it's always something going on,
Yeah.
especially now that they're all home with the pandemic. All the
Right.
kids are home, they're not in school, right?
Right.
So let me ask you this: have services, 30 years ago when you first started HIV treatment, did you start treatment? Did you go to treatment? Did you
No, I stayed when I found out uh, that I was HIV positive. I stayed out there for like a year. You know, because my mind was clouded with drugs and
okay.
alcohol, and one day I think I looked in the mirror and my body was like getting skinny and I was looking like a ghost or whatever. And,
Yeah.
I had hair at one time, and I just say, oh man, I gotta do something, because it was getting kind of scary out there. And then, I just went and got tested. And like I said, the rest was history.
So have the medication, my understanding is the medication protocol has improved and it's not as hard on your system. Is that
Yeah,
accurate or?
yeah, that's accurate. My brother's a pharmacist, and he told me about medications, and I also did my own homework on it. Any type of medication is very, very toxic. Aspirin can be toxic to you. But the medication has been improved over the years. I take Trimac, if that's okay to say,
Yeah,
and
whatever works. Yeah.
it's all in one pill. I take it every day, once a day. And I remember years ago, I used to take 2 and 3 medications. So the pharmaceutical part of it, they improved taking medicine once a day. And some people still take medications five times a day. And did my research. Like I said, HIV acts different on people, just
Okay.
like these drugs period acts different on people. It could affect you tomorrow, or it could make you do this and do that, get sick or whatever. But
Okay.
as far as my medication's going, and I think it is because I stopped my drug use that it's working a lot better.
Right, right, no doubt.
Yeah.
Well, we're coming toward the end of the show, and we
No,
covered
man,
it.
I wanna keep going. No,
I
no,
know
no.
we're gonna have you back because the fans look. We're gonna get a lot of fan mail about you. You know, they're gonna want everything. Hollywood, everybody's gonna want you. I know.
Hey, yeah, just let me know first. Don't give it out. Let me know first.
Okay, okay. And I want to cut as your manager, right?
Yeah, you got that. You got
Okay. So, is there anything that we didn't talk about that you want to share to a person that may be in active addiction right now? You know, should they go get tested for HIV, or if if they're shooting dope, or if they're having unprotected sex? You know, should they be tested or what?
all of the above what you just said. I would advise people. There's more to living out there, and I'm a prime example of it. You know, drugs not it anymore.
Yeah.
You know, it's start to living. You know, I would advise somebody, hey, if you want to get off of drugs, there's a lot of programs out there. You got family members that are into meetings and drug. I'm trying to find the words. There are a lot of people and a lot of organizations that can help you out there wherever you live,
Okay.
and especially a family member or a friend. And that's how I've gotten myself together. You know, because it started with family. They
Right.
get tired of you coming to them, and you know, stuff like that. And there's a lot of help out there.
Great. Oh, well, that's a great closing, man. Thank you. So in closing, I want to thank Parrish for coming on and sharing his lived experience with us today. Uh, and I want to mention that in Montgomery County, the Department of Health and Human Services / Public Health Services, Emily Brown is a good contact. They have the initiative where I stated earlier, federal government's trying to reduce HIV infections by 90% by 2030. And Montgomery County is one of the jurisdictions that the federal government is looking at to participate in this initiative. So Montgomery County will be rolling out some different initiatives as part of that development. So thanks again, Parrish. It's a very important subject, and I'm sure you helped a lot of people. This is James Sutton, and we'll see you on the road to recovery.
If doctors, nurses, and grocery store clerks can wear a mask for 10 or 12-hour shifts, you can wear a mask for an hour or less when you go to the store. Do your part. Mask up, America.